On Health Her Way, we're asking the questions you want answered about your body.
Together with our female healthcare experts, we're diving into the questions that might seem too scary, too silly, trivial, or taboo. No topic is off limits.
Join us as we talk about Health Her Way.
Welcome to Health Her Way. I'm Meredith Cunningham.
And I'm Brooklyn Elbert, and today we're joined with Dr. Katie Hendley. Dr. Hendley is a neurologist and movement disorder specialist with Covenant Health. She's attended medical school at the University of Texas in Houston. She stayed in Houston for her residency and fellowship training in neurology, specifically movement disorders. And she's been with Covenant since 2011. So welcome. We're happy to have you today.
Appreciate it. So there are all these trending topics about hot girls have this, hot girls have stomach issues, hot girls have this. And one of those trending discussions is hot girls have migraines. So I know, right?
Well, I have migraine, so
Hot girl. Hey, you know what? Hot girls have stomach issues. I'm just
There
going to
you
take the
go.
compliment where I can get
Yes,
it, too.
exactly.
So yeah, hot girls have migraines. Okay, so this is even better because not only are you a doctor who helps migraines, you have personal
me too.
experience with it. So let's start from the beginning. Like, what is a migraine? How is it different than just a headache?
Yeah, so headache is kind of a general term, and it's an umbrella term for lots of different types of head pain. And to be completely honest, most of these are clinical diagnoses. So we don't have, a migraine blood test or a migraine picture of your brain or a way that we can specifically say, you have migraine, you have tension headache, you have cluster. It does require, a doctor's visit, a clinical evaluation. Migraine has fairly specific characteristics. It tends to be somewhat unilateral and throbbing in characteristic. Oftentimes it is preceded by what we call an aura. And this is kind of a warning sign, often has some visual disturbances that sort of lead up to the migraine. People who are in a migraine, they would have sensitivity to light and sound, get very sensitive to that. It can last, 30, 60 minutes, sometimes up to a few days at a time. Oftentimes migraines do run in families. It is a much higher incidence in the female population. And so if your mom or your dad happen to have migraine, then you may have a higher chance for that. We don't truly understand all of the reasons that someone would have a migraine. But I can tell you that, our diagnosis less so, but our treatment has definitely evolved. We have many more options for patients who suffer with migraine to try and get, their quality of life back, because it can be detrimental to someone who's productive, whether they're working inside the home or outside the home. Migraines can really, take someone out. They tend to potentially cycle around hormones. Estrogen can be pro-migraine. And so mid and end of cycle, we can see some of that. And so treatment can kind of be tailored to that as well.
So how do you know if you have a headache rather than a migraine? Is it basically just like the severity of it?
The severity is part of it. Also, the characteristics. Again, a migraine tends to be, a little more sort of unilateral, throbbing. Again, sensitivity to light and sound. Not uncommonly, it can be accompanied by other symptoms like visual disturbances. People can have, numbness or tingling, facial droop, problems with speech, even kind of a cognitive fogginess surrounding a migraine. And then oftentimes migraines are relieved with some of our migraine treatments, some rescue therapies. You probably have heard of things like triptans that we have. Even, newer forms of rescue treatment for migraines, and then preventative. So if someone has, several migraines a month, then they may choose to go on something every day for migraine prevention. This would be different than, maybe a tension type headache, which can be more like a band-like sensation, around the head, kind of a squeeze, something after, we've had a really stressful day or staring at a computer. Those tend to be relieved maybe with massage, even over-the-counter medications, removing the stimulus, things like that. And so, but, probably seeing, a medical provider to help kind of tease out. And obviously you can have more than one, right? You can have migraine and tension headache. You can have, caffeine withdrawal headache. You can have lots of different reasons for headache, but oftentimes those who have migraine, they can clinically differentiate when a migraine's coming versus other types.
Okay.
You mentioned earlier that some of these symptoms can be so debilitating that people are hospitalized, and these symptoms end up mimicking the same symptoms as like a stroke or a heart attack. So you guys really have to kind of dig in and figure out what's going on.
Right.
But what would some of those symptoms be that are so debilitating that people end up hospitalized for them?
Sure. So it's not uncommon in the hospital that someone would come in with, let's say, facial droop, weakness on one side of the body, an inability to speak, a loss of vision. All of those can mimic stroke-like symptoms. And obviously, if someone has a sudden onset of any of that, we recommend a 911 call and a visit to the hospital because it could be a stroke. But oftentimes through the workup, their brain scan is negative. We can see the headache sort of come on after these symptoms. We treat with our regular migraine treatment and then find out that it was we would call this a complicated migraine, oftentimes a hemiplegic migraine. And so those are sort of extra debilitating as well and do require ongoing treatment and surveillance in those settings.
Wow, I didn't realize. I've heard they could be bad, but I don't think I realized they could be that.
A lot of them is kind of the first onset. I remember specifically had a patient, he was in the drive-through lane and lost his vision. He was ordering food.
Wow.
Lost his vision. Obviously, that would be concern, right? He came to the hospital and it described classically a migraine aura. So he lost his vision, but then you can see like light palettes or like you're looking through a ceiling fan, just pieces of the vision are out that last about 20 to 30 minutes. Again, there can be some cognitive fogginess. Maybe you're not as fluent with your speech. And then a pretty profound headache after that. Fortunately, his workup was negative. And we said, congratulations, you have migraine. And so that was sort of the first event that oftentimes, if they're not familiar with it, they do show up in the hospital, rightfully so.
You've mentioned this term, aura, and for those of us who are fantasy romance readers, like I was reading last night, it mentions your aura, which is like a vibe. But I believe you're here to tell me that there is an actual clinical term to aura and how it relates to migraine. So can you explain that?
Yes, absolutely. There is a different version of aura, and it is a medical term. And it's a sort of premonitory feeling of a migraine coming as part of the migraine. It usually specifically involves the visual symptoms. Over about 5 to 10 minutes, a patient would notice just changes, either light spots in their vision, again, pieces of their vision being taken out. Usually the aura itself is painless. It's just very noticeable that something's different. A lot of times, lack of focus and concentration. If I have an aura in the middle of clinic, I would have to pause because I wouldn't be able to take a history and communicate with the patient because I just wouldn't be able to fully do that. That would be the time that we recommend someone taking a migraine, what we call an abortive treatment, to try and stop it at that time. And then usually at about 20 to 30 minutes, the aura resolves, and then oftentimes the migraine would follow. So the aura is there. It's part of the migraine. We also call it the warning sign of the migraine.
Now, as someone who's experienced this themselves, and as you just were talking about, sometimes you're in clinic and you've had this happen to you. As a doctor, though, who's trying to help patients with this specific, does it help you understand because you've truly been there, done that?
It does. It does. Absolutely. So I can imagine, someone who hasn't experienced this personally, if someone were to come in and say, hey, like I just see spots in my vision out, or I see these colors and these lights. I mean, you could take that as, do you really though? Yes, like that is actually what you see. And, even some people have painted their aura. You could probably, look it up on Google Images or YouTube, what does an aura look like, and painting that during that time. Lots of research and imaging and functional MRIs done during the aura to try and further understand what is going on with the migraine. So it is a very interesting phenomenon. And I remember even growing up watching my mom describe her own aura and having, some confusional states at that time. So it is a fascinating condition.
That is interesting.
I don't really want to imagine it, though. It doesn't
Yeah. I mean, I had my first one in residency. It was scary. It was a neurology. I was like, oh, what is happening right now? So once you understand what it is, you can sort of take care of it and get on with life. But yeah, it's an interesting thing to experience.
Back to the treatments a little bit. I know you mentioned a medication that you can take earlier. We were also talking a little bit ago about some things we had heard, like getting Botox can help, or a
Mhm.
certain piercing for people with
Mhm.
chronic migraines. Can you talk a little bit about that?
Yes. So usually when we talk about migraine treatment, we talk about migraine rescue and then migraine prevention. And those are two different ways to treat migraine, can be used together or separately. So usually, if migraines are less severe and less frequent, you may just have a rescue plan. So in the event that you get a migraine, you have certain choices of usually medications in various forms that you would take, prescribed by your doctor at a certain frequency, and that would help with rescue. If they get to be frequent or debilitating, you may get on a prevention plan, and that goes from, medications once, twice a day. We have even monthly injections that someone could give to themselves, infusions that can be done. And also, if someone has chronic migraine, they may be a candidate for botulinum toxin injections in and around their forehead and the back of their head and down into their neck. That can be very beneficial for migraine reduction and sometimes even elimination completely. And then, as with most medical conditions, patients find other things that may work. And so, yes, I have had several patients jump on the daith piercing, which is, the inside of their ear. That not necessarily has been founded in data to be helpful, but patients find it's helpful. And if, it's something that they want to do, they can get that done. And I've had them report back to me that, it did reduce their migraine in some quantity. So yes, there are lots of different ways that patients would latch on to treating migraine. Again, it can be, we don't consider it neurodegenerative or shorten your lifespan, very debilitating in someone who's otherwise trying to be productive and work and have a normal quality of life.
I can imagine that if you're someone who suffers from these chronic, frequent migraines, you're so desperate to try anything.
Absolutely.
Um, Another TikTok trend that I saw was, and it's so funny because this was like, it seemed counterproductive, but one person was like, "Oh, dunk your feet in like really cold water; it'll help take your migraine." And then the next person was like, "Put your feet in really hot water." I'm like, "Okay, well now I'm confused. Like, they're supposed to be hot or cold." But I think that goes back to the desperation of like people are literally willing to try anything. Are
Absolutely.
either of those hot or cold water?
Those
treatments?
are actually new to me. I haven't heard of that. But again, is it unsafe? No. So if it works for you, absolutely try it. Most migraines or, a lot of common solutions are, either caffeine, a dark room, sleep tends to be very beneficial for someone who's in a migraine. If you can get a nap, that tends to sort of break that pain cycle. And so that is something that is helpful. But yeah, and then anything else that you can do at that time to relieve your migraine. I think I mentioned this before, but in and around the menstrual cycle, a lot of times women will have a plan during that time. And so leading up to that, maybe 2 to 3 days before they know they're going to start their cycle, they will start a preventative treatment because estrogen does lead to increased migraines during that week. And so they will have a plan for that week every month to try to reduce that migraine pain. So I think, the important thing is working with your healthcare provider. If you can track calendars, things like that, some people do have migraine triggers with food additives. That's not universal though. But anything that you can do, to have a journal or a diary to find any sort of pattern to help you with that is always recommended.
This podcast is about women's health, so we end up talking about hormones a lot
Mm.
because I think they
Mm.
play such a big role. At the same time, though, they seem to be quite problematic.
I know.
Well, being a woman is a wonderful, beautiful thing. I'm also, every time I hear, "Oh, it's your," I'm like, dang it, hormones, could you please give us a break?
Right. Yeah, I know. I mean, it's hard to, do we use it as an excuse? Not necessarily. I mean, truly, what we cycle through every month, one is beautiful and it makes us who we are and it leads to childbearing and all of these wonderful things. But yeah, it does come with a lot of times a catch. And I mean, I guess the upside of it is at least it's predictable, right? I mean, it's on a cycle of some sort for most people. And even, oral contraceptives can be used to help treat migraine sometimes because it can, if that is like your trigger. And I have, patients even in their mid and later stages of life who go through various hormone treatments for the treatment of migraine because it is the thing that does trigger their event. So
You said something earlier when someone's in the hospital and you're like, "Hey, good news, it's not a stroke.
Yeah.
migraine.
Right.
Okay, you're right. But strokes can happen later in life correlated to people who have migraines throughout their life. So how are the two connected? So like you may not necessarily be having a stroke at this moment, but
Right.
fast forward 30 years and that migraine actually may be a stroke this time. How are the two connected?
Right. The short answer is we don't exactly understand how, but we do know patients who have migraine with aura do have a slightly higher risk of stroke during their life. We think that probably that stroke risk is increased in someone with migraine with aura who's on a higher dose of estrogen. And then if you add smoking to that, that is a much higher risk of a stroke in someone who otherwise would not have um, a stroke. So, if two things are modifiable, one is high dose of estrogen and smoking, and someone had migraine, the recommendation would be, consider maybe modifying those to prevent stroke even, in a young life, not necessarily late in life.
I guess the only other question we would have is probably the same answer you're going to give for a lot of things of like, how can we mitigate our risk for migraines and then again, one day stroke? Is it the same thing we hear from our doctors all the time? Get your sleep, eat right, exercise, take care of yourself.
I mean, I think that's going to be a standard answer no matter what the question is. Migraine, though, is truly a neurological condition that is not necessarily preventable or curative. I think it does, you can go through seasons of life where your migraines are stronger than others for reasons that we don't quite understand. But the things that we know lead to better health, I think, would help with better health regardless of what the condition is. So absolutely sleep, things that we put in our body, which includes nutrition, energy drinks, supplements, sleep aids, alcohol, caffeine, just kind of, reevaluating the things. So I think maybe we, especially in this busy time of life of working and managing families and, kind of lose track of what we're putting in our body, and what we're doing over time. Obviously, physical activity and exercise, always on the list of things, reducing anxiety, stress, managing depression, in a way that, is truly working towards, a better overall quality of life. Yes, you would only hope that it would help with migraine and then stroke risk later in life. Even though stroke seems far off, in your 20s and 40s, that's the time to really mitigate your stroke risk. So don't underestimate what you're doing for your future self right now. And all of those things are important.
Okay. Well, is there anything else you want to touch on before we go or that you want to reiterate?
I don't think so.
It's time then. It's time for our trending topic episode. Let's see what you're talking about. You wanted to reach in for it, didn't you?
I did. I sent for it.
She was going to reach in. Okay, trending a full body MRI scan.
Have you heard about these?
Vaguely. It sounds like a really bad idea, but please enlighten me.
So a full body MRI that people have been talking about going and getting is basically just getting an MRI of their entire body just to see what's going on. And obviously your first reaction was that it's probably not a good idea. So can you explain to us why they're not beneficial?
Sure. So anytime I make a decision to order any kind of test for a patient, let's just say an MRI, I always like to go through the exercise with the patient. Okay, what are we going to do with the result? Let's say the result is positive, we would do this. Let's say the result is negative, we would do this. And so we have a plan either way on what to do with the result. Because here's the thing, like we are all very individual in our makeup, and we all have what we like to call incidental findings within us that are just that, they're incidental. And so let's imagine that someone did a full body, and it's a very detailed scan from head to toe. The likelihood of finding something incidental, let's just call it a lesion or a mass or a cyst or whatever you want to call it. Let's say you find there's a good chance you're going to find that. So then in someone who's otherwise relatively healthy with no problems, living a normal life, what are you going to do with that information? Because a lot of times it then sends you down the road of more tests and more appointments and more discovery in 6 months, and probably a lot of worry to get to it was an incidental finding. And so now your costs have gone up, your worry's gone up, your time's gone up. And so, when you order these very high level detailed medical testing, I would say you just need to be very specific about what you're looking for and what you're going to do with it. And then, honestly, finding a physician or somebody who's going to then deal with it. Because if you order the test, you're responsible for the result. If you don't order the test, I didn't have any reason for this. And so I'm not sure what we're going to do about that. So I think it leads to a lot of unnecessary worry, stress, cost, probably more testing, and the very low chance that you're actually finding something that's preventative that would better your health.
So if it's not a problem, don't make it one.
Right. Ignorance is bliss.
Yeah.
Right.
Okay. Well, thank you so much, Dr. Hendley, for joining us today. Really appreciate you and all of your insights.
You're welcome. Thanks for the invite. It was fun.
Of course. And if you want to see Dr. Hendley again, hit us up on our Instagram page, Covenant Health Facebook, and make sure you share and join us next time.
This podcast explores health-related topics with experts in their specialty for entertainment purposes only.
The information shared and discussed should not be considered as medical advice under any circumstance and is not intended to replace professional medical advice.
The views expressed do not reflect the views of Covenant Health System. For questions related to your personal health, always contact your physician.